been asking questions about biohacking since I was 12 years old. Except at the time, it was my parents who I was asking, why am I using this light? Why am I taking so many pills? Why am I laying on this bed that's supposed to give me different frequency and energy? And since then, now 25 years later, I'm still asking questions, except today it's more physicians, scientists, and individuals at the cutting edge of what regenerative medicine is and what longevity is and what it's like to live a long and healthy life. So today I'm joined with a brilliant panel here at Biohackers World, and I would love to invite you all to be curious with me, because I'm here to learn with you. I'm here to ask questions with you, for you, and we'll have an about 45-minute conversation, and then I'll leave 15 minutes at the end to ask some questions if I didn't ask something that you want to know. And just so we can get to know the audience a little bit, I would love to ask, by show of hands, how many of you have been biohacking for about a year? Okay. How about 5 years? Okay. More than 10 years? Nice. Okay. So we've got a nice and variety of expertise and level of biohacks, so we can go a little bit deeper into the science every now and then, which I would love, because I'm a nerd. Okay, we're talking about how we can live in a high-stress world without losing our body and our mind. And here are 3 individuals who have done a lot of work in this space, and I would love to give you guys an opportunity to take 60 seconds to just introduce yourself. What do you do, and what do you want the audience to take away from this conversation? So I'll start with you, Dr. Mahjoubi.
Thank you. Can everyone hear me? Okay, great. So my name is Dr. David Mahjoubi. I'm an anesthesiologist by training. About 12 years ago, I opened 2 ketamine clinics, one of the first in America. And so what I'd like everyone to take away from ketamine is that it's not just another psychedelic. It actually can reduce inflammation in the brain. It can increase connections between brain cells, synaptic connections, dendritic connections, and also reset the dopaminergic tone in the brain. A lot of people these days, through stress, have decreased dopaminergic tone, which leads to anhedonia, decreased pleasure in things. And so ketamine is really great at biohacking from an organic standpoint, and not just a psychedelic standpoint, which most of us just know it as. And so that's what I'm here to talk about.
Awesome. All right. Dave, take it away.
Is this thing working? No?
Hold on.
All right. No shortage of mics. Perfect. Hi, I'm Dave Pasco. I am a retired network security architect and engineer who decided about a decade ago to take my background in engineering and try to apply it to my physiology. And so what I hope you guys can pick up from our discussion today will be practical things that you yourself can do, mind, body, and spirit, to help lower your stress and improve your aging.
Great.
Dr. Park?
Hey, everybody, I'm Ed Park. I am a doctor. I was trained in OB. I've been doing regenerative medicine with stem cell exosomes for 7 years. So I'd love it if you come by the booth 61, sign up for my functional medicine podcast. I interview people on things like psychedelic-assisted therapy. We've interviewed Dave Asprey. We do mold, EMF, toxicity, autism, all that kind of stuff. And I treat patients in LA and 5 other states. So if you want to learn about exosomes, stem cells, and aging in general, because that's where I started biohacking 18 years ago with the telomerase activator, then come by and connect with me, booth 61, Ed Park.
Brilliant. Okay, so let's talk about stress. You guys all know stress. It's in everyday's life. It ages us, but it also makes us stronger if applied the right way. But today we want to talk about the chronic stress, the type of stress that doesn't push your body into adapt getting stronger, but the type that leads to maladaptation. So your body starts to break down both physically, cognitively, emotionally. I want to start with Dr. Park over there and talk a little bit about, go down to that cellular level, and what does it look like when our cells aren't able to adapt to the stress that we are exposed to?
Sure. Okay, so I think people misunderstand toxicity. We are toxic, and I don't just mean like spiritually, intellectually, emotionally. Like, that's why you have kidneys and a liver. You're constantly poisoning yourself. So the state of being alive is cleaning out ongoing toxins. But on a sort of allegorical level, you know, the thoughts we have from adverse childhood experiences, maybe from past life, we also create a lot of extra stress, which looks like rumination, anxiety. So, you know, you can go to therapists, you can go to Dave's Ketamine Clinic and get that erased, and that's all great. But at the end of the day, people have to have a human experience where they're hacking themselves and going, oh yeah, that's me, recreating this dysfunctional relationship like I always do because this is how I think relationships are. So ultimately, we're all biohackers, and at a core level, we got to get to know our own neuroses and ruminations, and at least watch them pass by like clouds instead of get wrapped up in the story, because that's when you start to pour out cortisol, which inhibits telomerase, which makes your stem cells not repair, which disrupts your sleep, and yada, yada, yada. So we're all living the same experience, just flavors, I think. So we're all biohackers, really.
We all are. And then when it comes to the brain, how does chronic stress impact the brain and also really compromise the way we can function cognitively?
Right. So chronic stress affects the brain in so many ways. One of the major ways is increasing glutamate through a glutamate storm, which is actually cytotoxic. It's actually excitocytotoxic. So that's one way, and that can decrease connections between brain cells, decreasing the functional capacity of the brain. Chronic stress can increase inflammation in the brain. It can affect the hypothalamic pituitary axis, which can increase cortisol. So there are many ways that chronic stress can affect us. And that has clinical implications because that can cause depression, it can cause anhedonia, decreased energy, decreased libido. So there's many ways. Yeah.
That's not a fun cocktail.
Right.
Okay, but I do want to, before I go to Dave, I want to ask, because you work with a lot of people in the spaces of trauma. And trauma is something that lives in the back of our mind, in the back of our tissues, and in every places in our body, but also in our brain. How does trauma show up in cognitive function?
Right. Well, people with childhood trauma, for example, or people with PTSD, as adults have increased heart rate, resting heart rate, which can cause anxiety. They can have increased blood pressure, and just be triggered more easily. So unresolved trauma, be it childhood or adulthood trauma, it can really affect us our whole lives if it's not treated.
That's scary. So we're going to get to solutions in a minute, but I do want to ask Dave about some of the things. You've been biohacking for a really long time. I mean, his pace of aging is impressive. Like, it's way below 1, which is amazing. And I want to ask you, how are you noticing the subtle signs that your body's giving you when you're pushing too far, when you are pushing yourself into overdrive and you need to chill out for a second?
Well, to be honest, I've done a terrible job at that in the past. Back in 2012, I took a telomere test, thinking that it was going to come back and tell me I had the telomeres of a 20-year-old at the time, and I was just turning 50. But the test came back and told me I had the telomeres of a 68-year-old, and I was shocked because I'm like, wait, what? I thought I was doing everything right at the time. But I mean, it turns out that I was just under constant stress, and I was unaware of it because that was just my life. I was doing very intense workouts, P90X. I was training for my first marathon, and I was taking care of both of my parents who had cancer at the time. So unbeknownst to me, I was just going from one stress to the next stress to the next stress. I thought each one of those was giving me a break from the previous one, but there was really no downtime. And so I had to learn how to do, or go back to, doing meditation and yoga to be able just to find time to chill out. And then, of course, getting fitness trackers, which really weren't available at the time, but are now. They've helped to show me exactly when I'm pushing, because I don't always recognize it in my own body.
And it is the hardest part. I mean, a lot of us who are using some type of wearable, we know, okay, my resting heart rate is trending the wrong direction. My HRV is dipping for weeks on end. Something's got to change.
Yeah.
But we're not really good at listening to those intuitive signs when your body is telling you you need to take a step back.
Yeah, they were there. I just ignored them and I pushed through them because I thought that's what you have to do to get through life.
But nowadays, wearables are getting good because, and if you look at it way too much, then it can be an additional stressor. So I do want to address a little bit about how do you not get your wearable to stress you out? Because I think my Aura tells me every day that I have about 2 hours, 3 hours of stress. And it's a lot, and I don't want it, but it just
The great thing is if you wear more than one wearable, they all disagree. So you can't take any one of them seriously. I'm wearing an Aura on this hand, I've got a Whoop on this one, and I've got a Garmin right here. So every one of them tells me a different metric for my sleep, like how long I've slept, what my deep sleep is like, what my light sleep is like. I mean, I can't stress out over any one of them. One might tell me, oh, you pressed too hard, you need to take it easy today. And the other one will say, oh, you recovered great, go get it today. What do you do with that?
Yeah,
right?
what do you do with that? Seriously.
And in that case, I have to really step back and think, all right, how do I feel? I mean, which one of these seems to be giving me the most accurate signal to what I am now perceiving? So it's made me more introspective about the signals that I was ignoring before, but now I'm focusing more on them. And then I decide which one of these seems to be the correct one.
Okay. Okay. It's a learning curve. That's
Yeah.
what I see. So, Dr. Park, when we talk about cellular optimization and really improving our cellular capacity to create energy to communicate and withstand the stress that we're constantly being bombarded day to day, how are the solutions you're working with help with that?
I've been taking a telomerase activator for 18 years, so I do a lot of telomere measurement. I used to, and and now we have the wearable devices, right? We used to say in training at Harvard Medical School, ask 2 doctors, get 4 opinions, right? So I think interoception is key. People need to know, how am I feeling? And the weird thing, it's like the dog that didn't bark. When you actually are healthy, you don't feel like anything. I recently hurt myself working out and I felt bad. I'm like, oh yeah, now I'm not healthy. But usually good health, it just feels like boredom. Like you slept a lot, you don't have any pain. So in terms of what I do, and I don't have the greatest health habits, I tend to have a glass of wine and sing some karaoke by myself in my very lonely bachelor pad. But I take TA65, which is a telomerase activator. So it briefly reacts, and at 59 almost, I don't need reading glasses, I don't have much gray hair. So it's allowed me to be a little more abusive in my lifestyle. Now, is that good? Probably not. But for everyone in the audience, when you're healthy, and it's the absence of health that's really noticeable. So all the stuff I wrote about in my second book for the Hay House called The Telomere Miracle, it's just common sense, free stuff, like sleep well, you exercise, keep control of your mind. There's a lot of great breathing hacks you can do just to put you back in the present moment. So yeah, you could pop a pill which activates your telomerase, or you could just learn to be kinder and more present with yourself and have good personal, health habits.
And if we go down a little bit on that scientific rabbit hole for exosomes, how are they supporting that cellular energy and cellular
Yeah, it's like a
performance?
hack. It's like a virus. So, they didn't know until about 20-something years ago that all cells communicate with these tiny 100 nanometer, the Pfizer vaccine, that was a 100 nanometer invisible sphere with mRNA in it. So, but every person that's ever been born, from a paper cut to being, shot with a shotgun, you're going to make stem cells go to inflammation and produce exosomes. But this crosses the plant kingdom too. So all cell communication is mitigated through exosomes, apparently. Who knew? So we can take some from a newborn baby placenta, and it'll briefly introduce like a program to de-differentiate local stem cells, and that often looks like healing cartilage, nerves, blood vessels. So it's just like a transient, little disc cleaner program or something. It tricks the stem cells to act young briefly.
So it just really improves that cellular resilience that you want to build up in order to be a little abusive every now and then and have some fun and live life and not have to feel like you're living in this biohacking prison where every calorie data needs to be on point in order for you to live a long time, because that's just not fun at all. And
Amen to
biohacking,
that. Yeah.
It's gotta
Nobody
be
wants
that.
to live like that.
No, God no. Okay. So, David, I want to talk a little bit about the brain and also going into that resilience. How does ketamine help improve brain resilience?
Right. So ketamine does a couple things. It increases BDNF, brain-derived neurotrophic factor, and that can increase connections between brain cells, and increased connections essentially rewires the brain. It increases the functional capacity of the brain. And so a lot of my patients have reported increased motivation, increased productivity after ketamine infusions or prescription ketamine. And another way it can help is when you're under a lot of stress and you get this glutamate storm, which can be toxic to the neurons. Ketamine blocks the NMDA receptor and reduces the amount of glutamate in the brain. So you don't get as much cytotoxicity from glutamate on the brain. And there's a lot of other ways also. Alcoholics, ketamine has been shown to decrease cravings in alcoholics by working on a particular area of the brain responsible for those cravings. And also by resetting the dopaminergic tone of the brain, it allows patients to feel again, to feel pleasure, to not be as anhedonic. And as we mentioned, stress can decrease dopaminergic tone in the brain, which is not a good thing. So there's a lot of ways. And also, it's a psychedelic, so the epiphanies, the realizations a person can get. In other words, the new perspectives on life. Maybe a person is in a toxic job or a toxic relationship, and so a new perspective with a short ketamine journey can certainly help.
I love that you mentioned dopamine, because a lot of us thinks that this is de-stressing and binge watching Netflix is de-stressing, but oftentimes we're consistently just depleting the dopamine and desensitizing our dopamine receptors. So we're gonna need more and more and more of the behavior that is not serving your cellular resilience or brain resilience. Now I wanna talk a little bit about, staying on the ketamine topic, about neuroplasticity. When we talked earlier, you mentioned that it enhances neuroplasticity, which is something, your brain's capacity to change over time based on the stimulus you give it. How does ketamine help improve that behavior?
Right, so 3 ways actually ketamine can help with neuroplasticity. One is activating microglia. They're cellular structures in the brain, and that can decrease inflammation in the brain, which is a good thing. Another way is through the NMDA activation, the BDNF activation, brain-derived neurotrophic factor. That increases connections between the brain cells, but also ketamine can elongate dendrites. That's an area of the neuron responsible for connecting with other neurons as well. And so by increasing the length of dendrites, which is the same thing transcranial magnetic stimulation does, actually, that can increase neuroplasticity. So really there's 3 organic ways ketamine increases.
Very cool. Okay, now I wanna go into a little bit to Dave's story, and what are some of the things you do to keep your brain on point, your body on point, and be able to perform at a level that you need to perform on a daily basis. Give us some practical tools, whether some of the things that you have done in the past, whether you've done exosomes, so maybe your experience with exosomes a little bit.
Okay, well, super practical that everybody can do is ensure that you're getting good quality sleep. Because, I mean, let's face it, your body is regenerating, your entire body is being regenerated while you're sleeping, especially your brain. And if you're shorting yourself on sleep, you're shorting yourself on that regeneration, so don't do that. I do exosomes. There's a thing called Club Exosome. I'm not a spokesman for them, but you can look them up online. They're clubexosome.com. They meet in Las Vegas quarterly, and so I do tend to go there and participate in that. It's a great event because you get to hang out with other like-minded people from all over the country, and so that's fun. And then you're getting your exosome treatments from Dr. Sandra Kaufman, and she's just brilliant to talk to. So.
Okay, now I wanna change gears just for a second and talk about inflammation. And a lot of people here know the level of stress that we're exposed to often leads to inflammation, tapping into that issue that causes you to age faster, which is one thing we all want to slow down. How are you? You did mention that ketamine does help with inflammation, and what are some of the additional things you would recommend individuals who are looking into ketamine to address when it comes to inflammation, so they can improve not only the impact of ketamine, but also just how their body responds to it?
Right. Well, in addition to ketamine reducing neuroinflammation, of course, as the panel has mentioned, sleep is certainly very important. Diet, reducing substances or foods that create an acidotic environment, such as, for example, if you eat a lot of protein or drink a lot of protein shakes, you got to drink a lot of water also, or alkaline water. Otherwise, you can be on the acidotic side, which can contribute to inflammation. And really exercise. Exercise, also good cardiovascular, high-intensity exercise, not just walking around your block.
And is it true that BDNF is also released with that high-intensity exercise? So we want to...
Yes, it is, actually. Yeah, good job.
So work out hard. Yes.
I just wanted to chime in. On the Recharge Biomedical podcast we did last week, we had Dr. Armin Nikogoshin, who has an autistic son, and we've had Jody Repko, who has a profoundly autistic son, and they're both reporting incredible results with body control. And so they're using exosomes on their children and on their patients, and they believe firmly that it's a neuroinflammatory mediated thing. And oftentimes when I give exosomes, I don't do it spray, I do it injected.
I was going to ask you about that.
Yeah,
I
we
heard
might
your
do
story.
it later. Yeah,
yes.
I did it to myself yesterday, and Dave Asprey's had it 3 times in the last couple of years. And some people get immediately clear vision. I think that has to be a current state of inflammation in the occipital lobe. But yeah, I think we did another Recharge Biomedical podcast with galactin-3 binder, the TB006, and they're getting great results in some people with Alzheimer's. It's not cheap, but it is FDA approved. And their basis is also that, you know, these ApoE4 people have different inflammatory pathways, and it causes the galactin-3 to gum up the brain, and they can free that up. So I think you're right, neuroinflammation is key. But, you know, doing the exosomes, they have BDNF, they have certain microRNA that allow for new dendrite formation and remyelination. So that's why we think we're just biomimicking nature. We're just using what she would do to heal a newborn baby. And we put it in ourselves, and yeah, it's not FDA approved, but we get some crazy results.
And I'm told sauna treatment increases heat shock proteins and also helps with BDNF as well.
I mean, those also sound like the types of stressors that will push toward that healthy adaptation that does, because initially it is a little bit of a stress on the body, on the cells. Does ketamine have any type of hormetic impact? Like a hormesis type of, does the body respond to it with an inflammatory response at all? Or is it particularly allowing the body to just deflame and recover?
Yeah, ketamine is known to decrease inflammation actually even throughout the body. I've had patients with Ehlers-Danlos syndrome who reported decreased edema even. But a lot of my chronic pain patients who tell me one reason or another have chronic inflammation, ketamine has always helped them.
Very interesting. Okay, Dave, I wanted to go to you a little bit with tests. We have talked a lot about tests throughout this conference, but I would love to get your perspective on some of the go-to ones that you are using to understand how resilient your body is, because it is my belief that resilience is what we're going for, and resilience is what's going to make us live longer. So how are you tracking your resilience, whether it is a weekly basis, something that you track weekly, a monthly, or 6 months or once a year? What are the top 5?
I'm a little not average when it comes to that because I do a lot of testing. Obviously, the fitness trackers will give you resilience scores, which are helpful. I also do blood draws monthly.
Monthly?
Monthly.
Okay.
Yes, because I'm constantly changing up on my supplementation to move all of my markers, not just into the reference range.
Yeah.
Because if you think about it, the reference ranges are set based on the population of people that have something wrong with them. Because a doctor won't give you a blood test unless there's something going on with you they're trying to diagnose. So if you're aiming for the reference range, you're aiming for the average range of a population of sick people. Why would you want to be in that range? So I target the optimal range for 18 to 25-year-old athletes, because that data is really well studied. And so changing up my supplementations to push those markers in those ranges, that's typically what I do. And then among those markers, it's not just what your doctor would run, but it's pretty extensive panels. I include a lot of the inflammation markers as well, just to make sure that everything's staying low.
Speaking of supplementation, I do want him to pull out the supplements he's got in his pocket because it's a lot. So somebody who biohacks for years and years, you guys know that there are tons of supplements you can be taking. A lot of people already know your basics. Now, that's Dave's. It's a lot, and that's just for lunch.
That's just lunch, yeah. I have a dinner one in the other pocket that's just as big, so I do over 200 supplements a day.
You don't have to do 200 supplements a day, but I do want to address a few things that go beyond the basics, because yes, vitamin C, D3, K2, your magnesium are some of the foundationals, but I think the room knows that really well. I would love to ask each of you, what are some of the ones that haven't really made mainstream knowledge and curiosity, where you think that it is the next thing that people really need to either not every day all the time, but cycle like you should every supplement?
Right, well,
go for it.
I think magnesium is great to take at night, especially magnesium glycinate or threonate. It could help you sleep deeper, longer. A couple other supplements I think every guy should take is boron and zinc, because they can increase free and total testosterone. And then there's some other ones. Fedocia agretis is really great for increasing testosterone. But those are a few of the ones that I take. And then with vitamin D, I recommend getting prescription D2 from a doctor, 50,000 IU. You could take it once a month or twice a month, depending on your level. A lot of the over-the-counter D3s, you got to take a lot to get your vitamin D up. And vitamin D really can help with energy. And so D2 prescription strength is great.
Okay. Dave, what are some of the, don't list all of them, we don't have time for that.
Oh, actually, you took some of the good ones that I was going to mention, so excellent list. I would say the ones you want to target are the ones that you're deficient in. So if you're not testing, you're guessing. So you need to test, find out what your blood markers are, and then supplement in whatever you need. Everybody is different in different stages of life. You know, we're different ages, we're different genders. We have different microbiomes, we have different genetics. I mean, everything about us is individualized. And so the same group of supplements that I'm taking may not apply to you at all because of where you are and what your status is. So you really do need to take an individual approach. There is no one size fits all. For me in particular, some of the supplements I take are things that I am either deficient in or I am trying to avoid. So for example, I have 2 of the same genetic markers that my father suffered from for macular degeneration. So I am doing a lot of things like astaxanthin, carotenoids, lutein, luteolin, things like that that are good for eye health, because I want to avoid the possibility of having that same macular degeneration. So again, what you're deficient in and what matches your genetics, those are the things you might want to target most in.
Okay. Before I go to you, I want to frame it a little bit different, because I think exosomes is not, and correct me if I'm wrong, because I could totally be wrong, I'm not a doctor, but it shouldn't be your first thing you do. Should you get your body's foundations right and perhaps deficiencies fixed before you do exosomes, or could you do it at the same time? Or perhaps maybe you want to detox a little bit before you do exosomes.
I mean, that's a great question. There's no right or wrong answer. If you have tennis elbow for 6 months, it's not getting better, maybe exosomes will help. But certainly, like, I have a patient whose son was a 29-year-old gamer, Mountain Dew, Pop-Tarts, and he had developed neuropathy. I'm like, bro, you got a vitamin deficiency. That's just it. And that can happen to a healthy vegetarian. They can get, B6 deficiency, thiamine deficiency. So the amount that your poor doctor learns in medical school is like, a couple of classes of nutrition. They know nothing about supplements. So everyone else is out there promulgating their magic fix. I'm promulgating my TA65 I've taken for 18 years. But I think Dave's point is well taken. There's a company here, SNP Nutrigenomics. I interviewed Kim Ressler, the founder, and some people do have gene polymorphisms where they're, heterozygous or even double deleted. So if there might be a nutritional deficiency that doesn't fall into a medical textbook, and you can supplement that, and that's good. But yeah, optimal is just above ground, conscious, without pain. Like, I think we treat our bodies like Ferraris, and they're not. They're not supercomputers. They do pretty well just maintaining themselves. So ADEK, fat soluble, can kill yourself. The B's, you'll pee out. But yeah, there are a lot of other supplements and herbs that are probably great for you, and a lot of it's just experimenting and trying. But yeah, always be cautious about someone who says their magic bullet is going to cure everything. I mean, that's just clickbait.
Okay, I want to go a little bit into the regulatory world, but not too deep. But I'm curious because there are a lot of misconceptions and there are a lot of confusions and questions around ketamine. I mean, it's made headlines for not the greatest reasons sometimes. So I would love for you to share a little bit about what is the right way of doing it. Does it always have to be in a controlled setting, or can I supplement with ketamine? How does that work?
Well, unfortunately, there have been some events in the last couple of years that have given it a bad name, one being Matthew Perry. He was getting vials of liquid ketamine illegally and injecting all day, every day, and the last day was in a jacuzzi. So clearly that's extremely, extremely excessive. I wouldn't even give vials all day, every day to somebody in a clinic. So, so that should tell you something. Now, given in the right amounts to the right person, it's amazing. It works much faster than any psychotropic medication. And a lot of psychotropic medications, like Wellbutrin, Prozac, et cetera, they do work, but they don't have the positive organic effects that I've mentioned in the last 20 minutes. Really, anyone can try ketamine. I've had patients come to my clinic who wanted to increase productivity and motivation and have new perspectives on things. You don't necessarily need to be depressed or anxious or have PTSD to try it. And you can also microdose with it with a prescription, which is what I provide now. You can microdose and journal for 20 minutes, get some new perspectives. You can microdose and release anxiety if you're someone with mild to severe anxiety on a daily basis. And as I mentioned before, if you're somebody who's had chronic stress, which has just made you anhedonic and reduced or taken away your dopaminergic tone, ketamine can help bring that back organically. So it's really useful in many populations.
Where do I sign up? I'm interested. Okay.
Sold. I want to ask a little bit a follow-up question with regards to if somebody wants to go deeper. I mean, I've heard in a lot of circles that people go for ketamine treatments and ketamine journeys to be able to untangle certain neural pathways and be able to resolve past issues. And I know we touched on this earlier, but I just wanted to share with the audience, paint a picture of what does it look like when we are doing that in a controlled setting.
Yeah, so of course it's dose dependent, but when a person gets deep, they could really have a journey through their life. And a lot of my patients tell me that they saw themselves as a child, or as a child interacting with their parent that maybe they have resentment towards, or someone who traumatized them and they've forgiven them by the end of the ketamine infusion. So what I like to tell people is a lot of times ketamine sessions, whether they be with sublingual tablets or an IV infusion, can be 5 therapy sessions in one. Because you can really get deep. And of course, if you couple it with a therapist who can help you get deep, that's even better. Yeah.
Because integration is really important. I mean, no matter what type of psychedelic you're exploring, going deep and then going back to your daily lives is not the best recipe for success. So you want to have that integration with a professional who knows how to make that experience last a lifetime or create a lasting change. Now, staying on that regulatory topic, I want to ask you, Dave, have you ever done anything that was questionable or wasn't allowed yet? I mean, you have been experimenting on yourself for a while, and I'm just curious if you've done anything. If you don't want to name it, it's fine. But I'm curious, like, have you done anything that's like red tape?
Well, the things that I did that were questionable at the time are pretty mainstream today, right? I mean, peptides, when they first came out.
How long ago did you do it first?
That's a good question. We're probably talking maybe 8-9 years. I mean, that's still relatively recent, though. I mean, peptides have been around for decades. Like the Russians were using it for their Olympic athletes probably back in the 30s, you know. So it's new to us here in the West. It's not new to the rest of the world. Rapamycin, I think I was one of the earlier people on that, as far as I knew, because I hadn't heard about it much. Even looking at telomeres as early as 2012, that was fairly new science. So I tried to jump on things as soon as I hear about them, as long as there's no downside, as long as there's no major risk.
Okay. And Dr. Park, how about exosomes? We talked earlier a little bit about there are questions that you should be asking if you are going to an individual who's going to give you exosome treatment. What are some of the questions to ask, and what are some of the red flags people should be looking out for?
I mean, I think the number one red flag is a doctor says, oh, you're going to get better. Okay, they can't say that. Like, yeah, maybe 60 to 70% of the time, this case is different from that. Do they get into numbers, billions? I can just tell you right now, and there's many videos on my channel, no one can tell you how many exosomes they have. Number one, they're invisible. So it's really a process, it's a tradition of trust. There's probably 50 to 80 manufacturers. Some of them have good quality, some bad. Maybe this week good, maybe bad. So everyone's chasing a kind of like miles per gallon, dollars per gallon. It's not, you cannot. You need a critical mass of serious people taking their jobs seriously and not trusting their own propaganda. So it's a very scary space. Consumer, buyer beware, forget about it. You got zero chance. They will lie or they won't know the answer. So branding is important. Yeah, but I want to turn back to like the whole, because this is 1 year anniversary. We've done 43 out of 52 weeks of Recharge Biomedical podcasts. And the first one was somebody I met at Biohackers World last year. And she does psychedelic assisted using psilocybin as her drug of choice. But she'll talk about therapy. And I think what's really interesting about biohacking at a really deep archetypal level is that we're all living this human experience, and we set up our software, which we call our program, right? Our default mode network, who we think we are when we wake up in the morning. Oh, I'm Dave, I'm Ed, this is what I do, these are my values. We don't wake up a Trump supporter and then become not a Trump supporter, right? Some do, some don't. But we create this binary world, and then out of that emerges personality and ego, and our perception of the world is completely fake. It's just a program. And so if you have a dissociative experience for 6 hours where you're just part of the trees and the air, then you realize, oh, this whole identity, this human experience is fake. It's just software. And that is a very powerful realization. My own 26-year-old had a journey with his friends on psilocybin. Around the time he did some neuroplastic generating exosomes, he became a new person. Happy, joyful, living in the present. Because so much of what we experience is just stuff that we're narrating over our own life. Oh, this is Ed on the biohacker stage spewing some nonsense. People think he's on drugs. It's like Morgan Freeman is like narrating our lives, and we think we're somebody. And the realization that identity is so false, it's just software, is really liberating for a lot of people. And I don't even believe in shamanism, but I once met this woman who did a thing, and she's nuts, but it literally was a Kundalini awakening, and it was like Ebenezer Scrooge. I flew back into my childhood, watching scenes of perceived trauma, valenced them, and turned the lead into gold, and it completely transformed who I was. And this was without drugs, without insight, without talk. So I think what I'm trying to say is that there is firmware. People know, their spirit knows what they need to heal and move on and grow and expand. And isn't that interesting that we all have firmware to heal ourselves? We know that the thing that we're focusing on is the thing that's crippling us, but it's enabling us to be dysfunctional, which we like. And so much of our time is wasted doing that. That's my human experience anyway.
I couldn't agree more, because everything around us is constantly disconnecting us from ourselves, from the world around us, from people. So it takes a conscious effort to reconnect and find who it is that you truly are and what it is that you truly need, without constantly trying to find the next best solution that XYZ on TikTok said it was magic. So I know we're not supposed to copy what other people do in biohacking to the T, but I'm curious, since we're talking chronic stress, cellular fatigue, and mental burnout, I want to go down the line here and ask, what do you guys do to address cellular fatigue and mental burnout in a chronic stress world? Like, what is your one thing for your physical resilience, and what is your one thing for mental resilience? I know it can be more, but I just want to know one, because that's what we have time for.
Well, I think physical resilience is really tied to mental resilience. So I just try to work out 6 days a week and not work too much. That helps me with mental resilience and burnout.
I would have to say being in a state of gratitude, because it's very difficult to be stressed if you're in gratitude. You can look at your life and you can think of all the things in your life that are wrong, right? Things that, if only this wasn't the case, if I only didn't have to deal with that. But if you look at things from a different perspective, a perspective of gratitude, all the good things that we have in our lives, things that we completely take for granted, that other people in other parts of the world don't have. For instance, I got to travel to Africa, and I got to see how people there in the villages were living their life. And they would wake up in the morning and they would literally sing to God that they survived to see another sunrise. And that's a big deal for them, because they're typically sleeping in huts without doors, right? In the middle of the night, something could crawl in and bite them, sting them, eat them, drag them away, rob them, beat them, sell them into sexual slavery. I mean, there's so many things that we take for granted. Our safety, the fact that we have a roof over our head, we have hot and cold running water that's right there in our homes. We have a sanitation system that we can flush and it just takes things away magically. If we really, really look at our lives, we are so incredibly blessed with the technologies and all of the things that we have. And if you focus on those things, it's very, very difficult to be stressed.
That's true. Okay. Dr. Ed Park.
I like to swim. That's great. And, I'm probably a functional alcoholic, so I enjoy that hobby. So, but, I want to reiterate, over the last 30 days, 2 civilizations have bombed each other into rubble, desalination, electricity, weaponry, citizenship, and we're just sitting here doom scrolling through Miley Cyrus. So I want to just point out just how surreal dopamine-driven, artificial intelligence-driven, AI bot-driven life is. Can you imagine not having water, sanitation tonight in Tel Aviv or Tehran? And yet we're up here just enjoying our lives. It's like the fact, I think my 26-year-old who did the psilocybin, and he's very optimistic. He thinks the consciousness is raising, and I hope so. Because, it's really a very bizarre world that we live in. So yeah, I swim, I have a glass of wine and sing Amy Winehouse, and that's how I get by.
I love them. Next time we're going to start out with you singing. That's going to be the first 5 minutes. So what I'm hearing is that stress, yes, is everywhere, but you need to take intentional steps in order to lower your stress load. And sometimes it means this weekend has been just intense. A lot of people are talking. You're going from meetings to meeting with brands, to learning from experts. And even for me, I took 10 minutes outside before the panel just to slow down, get some sun, re-regulate. And those small things make a big difference.